Enrollment in the Affordable Care Act, also known as Obamacare, is down about 4% in Texas this year. That's according to recent federal data.
The decline comes after subsidies that were enhanced during the COVID-19 pandemic expired earlier this year. KVUE's Brianna Perez explains how this is affecting patients right here in Austin.
For millions of Americans, the Affordable Care Act marketplace has made health insurance more affordable through tax credits that lower monthly premiums. But this year, those savings have shrunk for many enrollees, leaving some Texans facing higher costs and tough decisions about their coverage.
It was a very difficult conversation because, of course, this is affecting people's livelihoods, their access to health insurance and their medications, their specialists, all those things. And so really just trying to explain to them why they're seeing an increase.
Ashley Alvarez, Senior Program Manager at Prosper Health Coverage, says subsidies have helped lower or eliminate monthly premiums for many marketplace enrollees. Now some are facing higher monthly costs, forcing them to rethink whether they can afford to keep their plans. According to data from the Centers for Medicare and Medicaid Services, or CMS, Texas had almost 4.2 million people enrolled in ACA plans on January 15th, but that number decreased to 3.3 million by February 1st. That means nearly 900,000 Texans who selected a plan ultimately canceled their plan or did not pay their first premium.
A big part of that is because people are what's called passively enrolled. So if individuals had a marketplace plan last year, they're automatically enrolled in that same plan for the following year. And a lot of people don't know that.
Alvarez says she's seen an increase in people canceling their marketplace plans.
Some people got employer-based insurance. Some people are moving, and so they're having to change their plan. And unfortunately, some people aren't able to afford their monthly premium anymore.
During the last open enrollment period, Alvarez says the Prosper Center helped nearly 6,700 people explore their coverage options, but only about 4,300 ended up enrolling in health insurance. For those who did enroll, she says many chose lower-tier plans to reduce their monthly premiums.
They had to take that kind of step down for coverage, which it's long-term doesn't have as much benefit for them if they need to see the doctor regularly.
No matter the plan, Alvarez encourages community members to have health care coverage.
It is very, very important for people in the community, not just for those, annual checkups and, things like that, but in case of emergencies.
Open enrollment for Affordable Care Act plans begin November 1st, but experts say it's important not to wait. For those who need coverage but may not qualify or have access to insurance, we have a list of local resources available to help with this story on our website, KVUE.com.